Welcome to Doctors on Call. I'm Jenna Miller. Healthy eating is one of the best things you can do to prevent and control health problems such as heart disease, high blood pressure, type 2 diabetes, and some types of cancer. In the United States, more than 36% of adults are obese. Another 32% of Americans are overweight. More than 2/3 of adults in the United States are overweight or have obesity combined. The good news is that you can take steps to lose weight. Losing even some weight can make a big difference to your health and how you feel. Your heart, your brain, your entire body benefits from exercise. Fitness means being able to perform physical activity. It also means having the energy and strength to feel as good as possible. Getting fit can improve your health. Exercise, fitness, and nutrition, that's our topics tonight on Doctors on Call with our guest, Dr. Jonathan Pike.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from at Blue Cross Blue Shield of Kansas. We're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Hutchinson Regional Healthcare System. Our family caring for yours.
At Osborne County Memorial Hospital, our services range from clinic visits to inpatient and skilled care, but our specialty is you.
Your family is our family. The staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in north central Kansas.
Russell Regional Hospital, experts, neighbors, friends.
Dr. Jonathan Pike specializes in family medicine. The Great Bend native returned to his hometown to practice in 2018. In 2008, Dr. Pike earned an associate degree in general studies at Barton Community College, and 2 years later, he received his bachelor's degree in biology from Kansas State University. Dr. Pike earned his Doctor of Medicine degree from the University of Kansas School of Medicine in 2015. He completed his residency and postgraduate training at Via Christi Health in Wichita. Dr. Pike is on staff at the University of Kansas Health System Family Medicine in Great Bend. As a family physician, he enjoys seeing patients of all ages and also enjoys non-operative sports medicine and obstetric care. Give us a call at 800-337-4788 toll free with your medical questions about exercise, fitness, and nutrition today on Doctors on Call. Doctors on Call brings you information which may be useful to you when you see your own physician. Thank you so much for joining us tonight, Dr. Pike. We got a lot to cover, so let's jump right in.
Absolutely.
I'd like to start with the beginning of a person's day. How important is eating a healthy breakfast every day?
Yeah, so breakfast, when you think about it and you break it down, it says break fast. And so this probably will come up later on in our conversation, but there's a lot of fad diets that go on, and one of them is intermittent fasting. And so I think it's not so much the breakfast part or the morning meal that you would consider is the most important, but it's whatever you break your longest period in between meals. Because when we go without food, our body considers its energy needs and can be in a starvation state. And so that first meal that we eat, that's the meal that we want to be the most nutrient dense. And we can talk about nutrients on different levels. But so breakfast is easy because a lot of people associate fruits and whole grains and things like that, and so that's important. But you know, some people who work night shifts and their first meal is maybe in the evening, like that would be their most important meal of the day is what I would say.
So we do correlate fruits as far as in eggs maybe with breakfast, but a lot of people correlate donuts and sweet cereal. How detrimental can that be for a person to start their day that way?
Yeah, so I think when I think of food and when I talk to my patients about what's a simple way to remember what can we eat or what should we avoid, the first part that I say is the more natural something is and the least processed something is, those are the directions to go to. So things that are typically on the outsides of a grocery store, we have our fresh fruits and vegetables, we have our dairy products, and then things that are in the bakery or things that are processed, those get a little bit more dangerous. And I think it's easy to fall into a trap of wanting to look at food as a restriction and and saying, like, punishing ourselves if we eat something that we don't think is healthy, or someone tells us is unhealthy. But I think it's much more helpful to consider food as fuel for our bodies. And so one of the things that I would say is, or one of the things that I've seen is, out of all of these different nutrition plans or diets and things that go to, the ones that are typically the most successful are the ones that are best adhered to. And so you can't just eliminate all of the good things. Like, we want our food to taste good. That's the way we're wired and designed. So the other thing that I talk about when we talk about these things is what I call the 80-20 rule. And so if you think about a 7-day week, there's typically considered to be 3 meals a day. Most people eat a snack there. That adds up to 28 meals. And if you say, okay, 80% of these need to be nutrient dense, whether it's macronutrients or micronutrients and vitamins, and then the others can be things that don't adhere to those strict, like, nutrient dense foods, then that's about 22 to 23 meals that are healthy, and that gives you about 5 to 6 that can kind of be whatever you want to.
Mm-hmm. Sure. You had mentioned intermittent fasting. Can you explain what that is and how you feel about it?
Sure. So intermittent fasting is one of the nutrition plans that is being promoted, as far as most people will go throughout the day and not eat anything, or maybe do water or some sort of small fruit along with that, and they'll eat consume the majority of their calories and their fuel at one sitting. And there's pros and cons to that, and it really depends on what an individual's goal is and what they're accomplishing there. I think there are some people that have some different types of chronic diseases, potentially diabetes, well, that's probably not a good idea, because the management of diabetes depends on controlling blood sugars uniformly over the course of 24 hours. Whereas there's some other people who, I wouldn't advocate this as the only weight loss strategy by any means, but if that's what someone else's goal is, there could be an effect to that. But it's really what works best for people, and so in the right situations, I'm open to that.
Sure. Now, we hear a lot about keto and paleo. Can you explain what those are and how you feel about those?
Sure, absolutely. So this goes into a trend as well, and so paleo diet or nutrition plan, people would say, well, let's look at what our ancestors ate, and if our ancestors ate it, then that's going to be, and they lived and survived without modern nutrition, modern science, modern medicine, then that's going to be what's best for us. And one of the things I do like about the paleo diet is that pushes us into a lot of the fresh foods and pushes us away from a lot of the processed foods. Keto diet is different in its way of how you, you avoid carbohydrates a lot more, and high fat, and so all of these things, the goal for this to be successful is they put you in a calorie deficit, and so the calorie deficit is the total amount of calories we consume versus how much we output through exercise or our daily activities. So I'm not opposed to any of these, but they all have about the same outcome, and it's more so what a person thinks that they can adhere to and be successful with, and not that one's necessarily better than the other.
Is there some danger involved in if, let's say, you're strict keto, and then you go off? Is there any dangers to that?
I think your body, one of the great things about our body is it's really adaptable, and so it will try and to adapt to the fuels that we're giving it. And I don't think that there's going to be harm to your body when you go off of one of those more strict diets, but your body isn't going to necessarily feel good, and it can upset your digestive system and maybe give you some feelings of nausea or other uncomfortable feelings.
Sure. Let's talk about some steps for successful weight management.
Sure. So, you mentioned in the intro, you talked about obesity, and obesity is a challenge, and it's something that we face a lot. And I think it's so easy for different people who are in healthcare to point finger at one certain thing, but I think it's really important for us to remember as healthcare providers that obesity has a lot of different faces. Just like you look at the population and people have different heights, different hair colors, there's different factors that influence obesity. And so for us to be successful in considering weight management, that we have to look at this from all of the different factors. And so you can think of it from a psychology standpoint, and some of it is your internal psychology and how you think about your body image and weight. And then there's the community psychology, or the environment that you're in. There's what foods are popular in your geographic area, because we're in Kansas here. Meat and potatoes is something that we have plenty of, and like, I think a steak is great. I love it. But people who grew up on the coast where you have more fresh seafood available, and that lends itself to some different types of meats and different types of things. So that would be food. I think we have to talk about internal physiology. So we have, a plan for everyone is a plan for no one, because our internal physiology, while we all have the basic fundamentals the same, the genetic variation from person to person, that's going to play a role in how we process nutrients and how our weight plan goes. So I mentioned earlier calorie deficit and in regards to weight management, and that's really the key factor on if we are going to gain weight or lose weight. So calorie deficit, we will lose weight. Calorie surplus, we will gain weight. And then if we're neutral and we burn as many calories as we take in, then our weight will remain neutral as well. To manage that, we've talked about nutrition a little bit. The other way to look at this is exercise, and how are we burning our calories. If we, people like to break this down between strength and cardio. I think that's one of the two big ways that we can look at this. I prefer both. But if someone had to choose one or the other, probably strength, and that surprises people sometimes, that strength is the better avenue to choose. With strength, what we see is you're using the fuel that you're taking in, you're burning it down during the actual strength training itself as you exercise, and then the body has to rebuild with proteins, and so you're using energy to rebuild that, and then larger muscles will ultimately use more energy too.
Excellent. Okay, great advice. We've got Lola on the line now from Paradise. Hi, Lola. Go ahead with your question tonight for Dr. Pike.
Pardon?
Yes, go ahead with your question, Lola.
I was told that when you have a dramatic loss, that like 50 pounds in less than 6 months, that was when the cancer became active. Have you ever heard of that?
So there's different types of weight loss, and it's challenging to know because every individual situation can be different. But I would put weight loss into, there's a lot of ways we can divide this. I would put it into two categories in your question, where there's intentional weight loss and then there's unintentional weight loss. And certainly if a person finds themselves losing weight and they're not trying to do that, I think that would be a really good time to seek out some local health care, especially if you're trying to eat and gain weight and you're not noticing that. I think that's a good time to seek out local health care evaluation. As far as if someone is trying to lose weight, that gets a little bit more tricky when we talk about 50 pounds in 6 months. I think that there's healthy ways and unhealthy ways to lose weight. And if we, I mentioned a little bit earlier using food as fuel to our bodies. And so if we view food in a negative light, where our calories are evil and we're going to restrict them and we're not going to take in anything and we're still going to sit in a sauna, exercise until exhaustion, then that's going to cause rapid weight loss that's not sustainable and not healthy. But if we use food as fuel and we take in the nutrients and things that we need to fuel our exercise, then the weight loss typically isn't quite as rapid, but it can still be fairly dramatic if people make drastic changes on an intentional basis too.
Okay, great advice. How much exercise, we were talking a little bit about exercise before the call came in, how much do you recommend per week?
Sure. Again, I think it depends on individuals' goals. I think this was a couple of years ago, a study that I read, but one of the bigger risks that we've talked about, or people have talked about smoking, is that being bad. Another version of smoking that's in our modern era would be a sedentary lifestyle, where you go home at the end of the day and there's no additional movement and you're on the couch. And sedentary lifestyle increases the risk factors for the things that we've talked about: high blood pressure, diabetes, and obesity. So the minimum to combat the sedentary lifestyle would be 30 minutes of cardio 4 to 5 days a week. One of the nice things that they found when they were looking at the studies of sedentary behavior is that 30 minutes in a given day doesn't have to be consecutive. So if you have 10 minutes in the morning, 10 minutes on lunch, and then 10 minutes in the evening, you can break it up into 10-minute chunks, and that cumulative effect in the 24-hour period is still beneficial. I think the challenge that we see is, I hear people say, well, yeah, I walked for 30 minutes, but it was a very casual walk, and it was slow, and it didn't really affect your heart rate. So we do want to see a change in heart rate to a degree on this, not smartwatches help keep track of this now, but not everyone uses that. So a good measure of heart rate is you can't talk in complete sentences, but you can talk in short phrases, but you're breathing hard enough that you can't do a full sentence.
Sure. And what is the best time of day to exercise? You hear sometimes that first thing in the morning is, gets your metabolism running. Is there any truth to that?
There's a little bit of truth in that, but I would make the argument that the best time of day to exercise is whenever it works best for you. I think consistency in a program and consistency in nutrition is going to be much better than trying to follow a rule that doesn't work. Some people have to go into work at 5:30 or 6 in the morning, and some people who do that still like to get up earlier and work out. Other people say, I don't really want to do that. And other people might say, you know what, like my mind is fresh and sharp at the beginning of the day already. I want to focus and be productive. And then as the day goes on, I get more stressed. And if I go home and I work out, that's the stress relief for me. So yes, you can work out in the morning, but I would argue for whatever is most convenient for your schedule is the best time to work out.
Excellent. And does exercise, do you find that it improves sleep?
Absolutely. So exercise and sleep have a very powerful relationship. So one, a lot of times when we have difficulties with sleep is our bedtime routine. We haven't exercised that day. We've been watching the TV. We've been on our smartphones all day. We came home and we've been on the couch for 2 hours and watching Netflix or streaming videos, or you can pick, but we're not moving and being active, and then we're overstimulated in the wrong ways, and then our brain doesn't know how to cope with that. So I would say exercise improves sleep, but then I would also say sleep in general is an important part of our conversation today with our nutrition and exercise. Sleep is when our body recovers. Time recommendations for sleep, gosh, it depends on which study you read, and you ask 10 people and you probably get 11 different answers on that, but most of them land somewhere between 7 and 8 hours for adults, and I've started to see studies that if you go past that, that's negative for your health. If you're under that, it's negative for your health. I think there's still time to decide that, but you should be waking up feeling rested each morning.
Is it necessary to find a good gym or health center, or is it possible to get a good workout just at home?
Again, I think whatever it allows you to be consistent for you, there's a lot of good opportunities for that. I think the recent pandemic really opened the eyes to a lot of people, and I saw the pandemic split people one of two ways, where their gym or their health center closed, and it was kind of closed indefinitely. And they're like, I don't know what to do without my routine. And they gained 10 or 15 pounds because they lost their routine, and then they're not going to work and they're not doing all these things, and it's easy to, it's easy to eat, and then you're wearing your sweatpants, and you don't have to say like, oh, my belt notch went up a pound. But then there were other people who said, no, I have more free time. I don't have the same work meeting schedules, so I'm going to use this as an opportunity to find what I can do at home. So I think, again, determining your individual goals is going to be the biggest step, And sometimes people need a community to motivate them to exercise. And then I would find a gym or fitness center that works well, where they either have group exercise classes or they have, it's something that's convenient for some of your close friends to go do that. Other people, timing is a key. And I think in rural communities, we don't see the same gym hours of operation that we get in some of the larger communities. And so in that case, home exercise equipment is available. And I think a lot of people hear home exercise equipment and they think of a treadmill or an elliptical or a Bowflex or some of these things that you've seen on commercials. I think with the advent of social media and YouTube and other things on the internet, I think this would be something to discuss with your own physician, but I think you can look up home exercise programs and you can get a lot of benefit from home exercise programs with just some dumbbells or some resistance bands or no weight at all. There's a lot of ways to do home exercise programs that way.
Excellent. We want to remind our viewers that we're talking about exercise, fitness, and nutrition tonight with Dr. Jonathan Pike. Give us a call at 800-337-4788 if you have a question. Let's talk about portion control, and you hear a lot about that. Is that important for everyone?
Yes. Portion control, I would take this back to our calories, and the calories are the biggest measure of where we're going to gain or lose weight. I think with portion control, the challenges are the community and the world that we live in is designed to get us to enjoy more food because that's how they earn their living, and I don't think there's anything wrong with that. I think nutrition labels are extremely important in keeping track of calories. I think when you look at the nutrition labels, they give you the percentages of a 2,000 calorie diet. Again, there's so many different things on smartphones and on the computer of where you can put in your height and your weight, and you can say like, oh, this is how many calories I burn. Because I mean, we're burning calories just sitting here having a conversation, which is pretty cool about our body. We burn calories while we sleep, and so we have this basic slow burn of calories, and then we can choose with fitness and exercise to burn more. So going back to portion size, then, you know, some people are very intense and strict with this, and they get their scale and they say, I need this many grams of protein, I need this many grams of carbohydrates and this many grams of fat, and they do that, and I think that's wonderful if people can do that. I don't advocate for that very much because that's an endeavor, and I try not to ask people to do things that I wouldn't do myself. But counting the calories, I think, at least starting with the macronutrients, if you keep track of that, I mentioned that kind of going back to the different types of fad diets that we talked about. A balanced macronutrient is going to be about 55% of your macros come from carbohydrates, about 20% from protein, and 25% from fats, if my math's right.
Okay. All right. We're going to go back to the phone lines. We've got Gordon on the line from Salina. Hi, Gordon. Go ahead with your question tonight.
Yeah, I'm losing weight, and I'm trying to gain some. And what food does he recommend to gain weight with?
Thanks for your question, Gordon. As far as trying to gain weight, you can look at any sort of food that tastes good. So look for foods that have a higher calorie count per portion size or per serving, and the more calories that you put in, the more it will help you gain weight. I think the caution with that to be is like, I could go eat a Hershey bar, and that has, I think I looked this up before the show, I think it has 200 calories per serving, and there's 3 servings in a single bar at the store. So I would look for things that also have nutrients, but I also think if this is something that you're trying to gain weight, making sure that you ask your doctor too, but things that have high protein, high carbohydrates will certainly help you in that endeavor.
All right. Well, thanks goes out to Dr. Jonathan Pike for being our guest tonight on Doctors on Call. On our next Doctors on Call, we'll be discussing gastroenterology and chronic care. You can email questions to us for our next program at doctors@shptv.org. Thank you for joining us for Doctors on Call. I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from At Blue Cross Blue Shield of Kansas. We're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Hutchinson Regional Healthcare System. Our family caring for yours.
At Osborne County Memorial Hospital, our services range from clinic visits to inpatient and skilled care, but our specialty is you.
Your family is our family. The staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in north central Kansas.
Russell Regional Hospital, experts, neighbors, friends.